Simpson predicted that millions lose health coverage after Trump's tax bill approved in July 2025. At first, people cheer, thinking they'll pay fewer taxes. But soon, things turn dark.
You guys are the Make America Healthy Again group, right? That's why RFK Jr. just removed $500 million in contracts for mRNA vaccine research because apparently they just don't work. They do. They're peer-reviewed. They're scientific. And the only reason we live to the age we live to right now is because of vaccine.
Let me tell you guys, being a therapist right now is crazy. Because if you don't know it or you don't feel it, we are going through another 2020. I think it's even worse than it was before with the mental health crisis. Everything that is coming up is 10 times worse than it was in 2020.
Hi guys, welcome to my channel. My name is Alex, and today we're going to be talking about healthcare crisis when getting sick breaks the bank. Medical costs are skyrocketing and insurance doesn't always cover enough. People delay care because they cannot afford the bills. Prescription prices keep climbing while wages stay the same. Healthcare should heal, not bankrupt families. Now, without further ado, guys, let's dive into the videos and watch.
Top 10 states where healthcare is getting worse. You'd think after a global health crisis, states would be investing in healthcare, but in a lot of places, it's getting worse and fast. So here are the top 10 states where your access to healthcare is collapsing right in front of you. At number 10 is Georgia, where over half the counties don't have a single OBGYN, and the state still hasn't fully expanded Medicaid. Pregnant and poor, good luck. 9 is Texas, where the uninsured rate is the highest in the country. They have the money, they just refuse to use it to help people. 8 is Mississippi, where hospitals are closing so fast it's being called a slow motion catastrophe. Entire counties are becoming medical deserts. 7 is Florida, not because it's poor, but because it's punishing providers. New laws are pushing doctors out of the state, especially those offering gender-affirming or reproductive care. 6 is Alabama, where they just criminalized IVF, and rural hospitals are shutting down left and right. 1 in 3 hospitals are at risk of closing. 5 is South Dakota, where you might not expect it, but they have some of the lowest provider-to-patient ratios in the country and some of the highest ER wait times. 4 is Missouri, where ERs are overwhelmed, Medicaid redeterminations are booting people off of coverage, and patients are literally being denied cancer treatment over paperwork. 3 is Louisiana. Since 2020, they've lost over 70% of their maternal health providers. Some hospitals are hiring traveling nurses just to keep the lights on. 2 is Oklahoma. State leadership keeps slashing funding, and doctors are leaving in droves. It's getting so bad that people are driving hours just to get a basic checkup. And the number 1 state where healthcare is getting worse? Tennessee. Since 2010, more hospitals have closed here than in any other state, including the only trauma center in a major city. Add in strict abortion laws and low insurance access, and people are literally dying from preventable causes. This is what happens when states treat healthcare like a luxury instead of a right. If your state's on this list, or you think it should be, it's time to speak up. Call it out, because staying quiet only helps the ones cutting care.
Yeah, what do you think, guys, about that? Let me know in the comments below, I think it's a pretty interesting statistic. From what state you are, please write me in the comments too, and please like, share, subscribe. It's really important for my channel to grow, and I try to grow this channel. And I do appreciate this, guys. Okie dokie, let's dive in the next video and watch.
While Ontario nurses tell us they are exhausted and burnt out, that hospitals are overrun and understaffed, and that patient care is suffering, the health minister boasted about her government's accomplishments and investments in Ottawa this week, painting a rosy picture of a system in trouble.
These investments are providing Ontarians in your community with more care than ever before.
But the experience on the ground is different.
It's very misleading. Being here at the bedside does not match what is being said.
It's not okay to say that because You have to come in and have a look at the front line.
Rachel Fleming and Iram Chagala have witnessed firsthand a deteriorating system in the decade they've been practicing nursing in this province.
Our healthcare system is a broken one that needs a lot of repairs.
The nurses tell us hospital staffing shortages have not improved, despite promises by the Ford government to expand the workforce.
Since taking office, our government has added a record-breaking number of nearly 100,000 new nurses and over 15,000 new doctors registered and licensed and practicing in Ontario.
The issue is that as much as we add nurses, the population grows, right? And we are not adding enough, and also there is exit of nurses.
There are currently 16,000 nurses registered but not practicing in Ontario, in part because of poor working conditions. And despite the government's investments in new medical schools, hospitals are reluctant to hire new grads.
A lot of the postings that they are putting out, they're expecting at least 3 to 5 years of hospital experience. How is a nurse supposed to get that if they can't be hired?
Fewer hires means more patients are left without care. A recent study found with every patient added to a nurse's workload, the risk of death increases by 7%.
There's patients that are more life-threatening than others. There's those that are stable one moment, but then they become unstable in the next moment. I think it becomes very overwhelming for a lot of nursing staff.
The study urging Ontario to implement mandatory 1-to-4 nurse-to-patient ratios to save lives.
At the end of the day, it provides a patient safety, better outcomes.
While nurses are still stretched thin, the Ontario Hospital Association tells us the workforce is growing. Hospitals have hired an additional 7,500 nurses and 5,600 registered practical nurses since 2019. Hospital vacancy and turnover rates have also decreased, and retirement rates are now lower than pre-pandemic levels.
Yeah, God, this is what happened, in Canada, So I trying to get the different, thoughts and different data from not only from states but also from Canada and other places, if I can. So I hope you enjoyed that. Okay, guys, let's dive in the next video and watch.
Simpson predicted that millions lose health coverage after Trump's tax bill approved in July 2025. At first, people cheer, thinking they'll pay fewer taxes. But soon things turn dark. Hospitals in Springfield begin to close one by one. Nurses and doctors are laid off. The emergency rooms are full, but no one is helping. People dying from treatable illnesses. People line up outside clinics holding crying babies, sick grandparents, and urgent prescriptions, but they're turned away. The news shows scenes from across the country. Over 30 million Americans lose access to health care overnight. The economy takes a hit. With no health coverage, people stop working. Businesses close, grocery stores sit empty, school nurses disappear, insurance stocks rise, but nothing else does. Even Mr. Burns looks uneasy as he watches the stock market crash. Homer turns off the TV and says, "We stopped caring for each other." The screen fades to black. A message appears. A nation is only as strong as how it treats its weakest.
Yeah, what do you think about Simpson here, guys? Do they right or not? Let me know in the comments below, guys. It'll be very interesting to hear about that. Okay, guys, let's dive in the next video and watch.
You guys are the Make America Healthy Again group, right? That's why RFK Jr. just removed $500 million in contracts for mRNA vaccine research because apparently they just don't work. They do. They're peer-reviewed. They're scientific. And the only reason we live to the age we live to right now is because of vaccines. So people who are applauding this, do you know you're applauding waste? Because most of these projects, the government's already paid for. They're ending them early, meaning all of that research up until the day, August 5th, is now a waste of time, a waste of our money. Why wouldn't you let them finish their research? It's already funded. So now you're going to cancel it. You're going to lose all that research, all that knowledge. And this is the cutting edge of vaccines. We have no idea what kind of respiratory viruses could come down. We already had COVID. And yes, we have moved on from that, but there can be more. Have you seen the movie Outbreak? We need to be prepared. And cutting off research is going to do nothing but harm those knows, first of all, who that's their job. You've now unemployed how many thousands of people on top of all the elderly and those with pre-existing conditions who are not going to be able to utilize this research because you're getting rid of it because you just don't think it works, no matter how much science is behind it. You are the party of the uneducated, and if you are in support of removing research into future vaccines, you don't care about people, meaning you are not pro-life.
Okay, what do you think about this, guys? Are you agree or not? Let me know in the comments below, guys, about the vaccines. It's pretty interesting thing, and I will be very happy to read your comments below. Let's jump in the next video and watch.
Let me tell you guys, being a therapist right now is crazy. Because if you don't know it or you don't feel it, we are going through another 2020. I think it's even worse than it was before with the mental health crisis. Everything that is coming up is 10 times worse than it was in 2020. Look at me, I'm in my pajamas trying to make it through. I haven't even been on TikTok because I am busy holding space. Some of my clients are doing very well. Some of them are graduating from services while other people are really struggling. So pray for your therapists out there because, girl, we in the trenches. Okay, we got our bulletproof vest on. We got our mask on. Okay, we got our capes on. We are in the mud. Okay, it is really hard out there for us right now. Trying to hold space for ourselves, trying to get through all the different things that are going on in the world. But yeah, therapy right now is like very intense. Like these last couple of weeks, I have felt extremely tired because people are going through it, and I'm here to hold space. I'm here to try and make things feel a little bit, is the right word better? I don't even know, girl. Okay, look at me. Look at me. Okay, I'm in the trenches. All right. But just know, if no one's talking about it, mental health right now is very bad. Everyone's in a crisis, are going through something, whether it's a job loss, whether it's trying to cope with the erasure of LGBT. A lot of things are going on, people coming up missing. And we as therapists are here to hold space, and we're trying, okay? I am trying, okay? I'm trying to get my own life together. Look at me, girl. I'm in my pajamas, just trying to get out of the bed. Luckily, I got braids because I ain't got to worry about doing my hair, all right? But yeah, I'm here. I'm trying to make it through just like y'all are. But just know, like, as therapists, we out here trying to survive too.
Yeah, you see, guys, mental health is also very important. So we have not only a health crisis, but also have a mental health crisis. So I'm trying to add different, thoughts from different people here that they want to share with us in this show. So I hope you do appreciate this, guys. Please like, share, subscribe. It's really important for me, guys. And let's dive in the next video and watch.
In 2025, women in the U.S. have fewer reproductive rights than they did a decade ago, and somehow we're supposed to be okay with that? Access to abortion is now banned or restricted in over half of the country. Maternity wards are closing in rural areas. Some women are being denied life-saving health care because doctors are scared of breaking state laws, and still no national protection. This isn't about politics, it's about control, and the message being sent that women's bodies are battlegrounds again. So no, we're not going back to sleep on this. If you're feeling angry, exhausted, or just plain confused by what's happening, you're not alone.
Also interesting thing here. Guys, let me know what do you think about that in the comments below. And let's dive in the next video and watch.
It's Dr. Potter. United sent me a letter, which I'm going to share in its entirety here, and they denied my patient's overnight stay. I'm going to let their words speak for themselves. What I have to say is that my words were true, and I was honest in my statement in the video. And I'm sure you'll have questions after you read United's letter, and I'm happy to respond to those in some other forum. I'm not going to be silenced by threats when it comes to speaking out for my patients and for my ability to take care of them and for what's going on in the healthcare system. If I don't speak out, then I lose. I lose my integrity, and I lose my voice, and I lose the opportunity to make a difference. And although it is a bit intimidating to have a company like United send a letter like this to me, I know where I stand. I'm a woman taking care of women who are affected by breast cancer. And I know that I do that with all of my heart and in a way that I can be proud of. And I spoke up when I needed to, and I'll keep speaking up. So I would just ask you guys to follow along, share this story and this letter in your communities, because I think that I'm not the only one. And it is scary to stand up against the healthcare system when it's such a wealthy and powerful group of organizations. But it's going to take all of us telling our stories and being honest to make a change. And I am here for it. So yeah, here we go.
Yeah, very brave doctor. I hope she's gonna be okay and everything's gonna be alright with her. Okay, guys, what do you think about that? Let me know in the comments below. You know, what this United Healthcare company do for us. You know, what is going on. I will be very happy to read all your comments. And let's dive in the next video and watch, guys.
The definition of the healthcare system in 2025 in America is as follows. It is the management of symptomatology and the monetization of human suffering. That's what it is. That's a reverse engineered healthcare model. The current one. That's what it is. So when that is the root drivers of healthcare, those are the root drivers, okay? Money, revenue. You're a commodity, by the way. You are a commodity to the healthcare system. They don't want you to get well. They want you to stay sick. They want you to need more from them. And so until people realize this and start taking some things into their own hands and not thinking they can't do it, because you can, especially with the advances in technology, you have to. Otherwise, something could happen, and something will happen to everybody, by the way. Something happens to everybody, and you'll be, in the retrospect, then you'll be retrospective saying, man, I wish I had done something on my own. I wish I had done my own research and not just believed the doctor knows what he's doing. Because a lot of times they don't, but they act like they do. It's built into them. It's conditioned into them to, even if you don't know what you're doing or what you're talking about, come across like you do. And what happens with that? Do you think anything bad to them happens? No, nothing happens bad to them. It happens bad to you. You're the one who suffers from it. So not doing your own due diligence, not doing your own research, not learning whatever you can about what's going on with you, you are screwing yourself. You're screwing yourself. If you think this system is here to save you, it will probably kill you.
Yeah, interesting thought of this gentleman that decided to share it with us on our show, you know. So he thinks that we are more like a commodity for this health, guys, you know. So what do you think about that, guys? Let me know in the comments below. Let's dive in the next video and watch.
Patient safety concerns for 2025 is a trend that you can't ignore. Just this week, ECRI, the nonprofit organization focusing on patient safety, put out their annual list of top 10 patient safety concerns. Number 1 on the list this year was doctors being dismissive to patients, families, and caregivers. ECRI has been putting out this list for over 60 years. The last year, 2024, the number one concern was healthcare practitioners not being ready for practice. And we know we can see this in graduates from programs such as nursing, pharmacy, etc. By the way, my name is Dr. Julie Seamers, the patient safety expert here to help make healthcare a safer place for all of us. I've been a critical care nurse and an educator for 45 years. The criteria to get on the top 10 list that this organization uses every year is severity, frequency, breadth, meaning how far does this spread, insidiousness, meaning is it difficult to detect or to track, and then the last one is profile, and that would be the pressure on an organization to actually do something about it. A large survey in 2023, participants stated that 94% of them agreed that they are or felt dismissed by their physicians or healthcare providers. They don't feel listened to, they don't feel heard, and they don't feel understood. Dismissiveness can occur or come from biases, not understanding, or preconceived ideas. Let me give you an example. My first job in nursing in the hospital was on the oncology floor. I was taking care of an 18-year-old girl who was dying of breast cancer. She had gone to her physician with a lump in her breast and was told, "You're too young to have cancer." By the time they figured out it really was cancer, she didn't have any hope, and she died just after turning 19. Here is 3 tips for you tonight that you can apply to advocate for yourself and your family members to keep yourself safe. Number 1, track your data, whether that's your weight, your blood pressure, your blood sugars, and keep a log of that to be able to take it to your physician when you have your appointment. Number 2 is to understand your disease, and then you can report back when your symptoms are becoming worse. Let's just say you have asthma, and what you can say to get the attention of the provider is, "I'm having to use my inhaler more." Again, that's going to tell them exactly what's going on and why you're concerned. Another example, let's just say you had abdominal surgery last week and now you're feeling more intense pain and a different kind of pain than just after surgery, or you may have a fever now. It could indicate that you have a foreign body left inside you from surgery, a gauze sponge, even a pair of scissors. And number 3 is to understand your medications and the side effects. What is it indicated for, or what is the action expected? And that way, if you call your physician and say, "I'm having dizziness since I started this medication," track it and time it so you can give specific information.
Yeah, very interesting thoughts, guys, from this doctor, and she giving you really good advices too, from my point of view. So I think, that's why I decided to add her in this show, and I think it's really useful. So let's dive in the next video and watch, guys.
Hi, I'm Dr. Rhonda Johnson. Today is Thursday, February 6, 2025. Today I'm discussing the global aid crisis. For those of us who care about global health, these are some difficult times. The United States has withdrawn from the World Health Organization, and the Trump administration issued an executive order halting foreign aid and USAID programming. Folks, these actions put the health and well-being of millions of children and families at serious risk. The United States has been a major provider of famine relief in the humanitarian crises around the world, including the ones in Gaza and Sudan. Now, essential programs that support maternal and child health, infectious disease prevention, fighting malaria and TB, and life-saving HIV treatment are in serious jeopardy. Why does this matter? Again, U.S. foreign aid has been crucial in sustaining healthcare delivery worldwide. Programs for mothers and newborns and malaria and disease prevention are now at serious risk, and health systems will lose resources, staff, and operational support, undoing decades of progress. Hundreds of thousands of malnourished children could die without USAID intervention, experts say. Now, I've shared this before, but I've done missions on the ground in Haiti, Mexico, Brazil, and Kenya. It's not a lot of places, but I've seen how the interplay of challenging living conditions, infectious disease, and malnutrition can plague the health of generations. Children are our future, and maintaining their health and well-being must be a global priority. This is a crisis we just cannot ignore. So if you care, I'm asking you to take action. Contact your elected officials and demand the restoration of foreign aid, because lives depend on it. That's my message today. Take care, folks, and be well.
Yeah, interesting thoughts, guys. Let me know in the comments below what you think about that, guys. We definitely have a health crisis right now, so we need to be prepared, and information that I'm providing, I hope it can be useful for you guys, that I'm providing this show. So let's dive in the next video and watch, guys.
Okay. I just left the gynecologist's office. That's how every woman wants to start a video on TikTok, right? Can we please, for the love, it is 2025. You guys treat women like we're another freaking species. Please stop trying to fix women's issues with birth control pills. And then when we say we don't want birth control pills, you look at us like we're freaking crazy because we actually want to figure out the root of what is causing all of the issues. We do not want you to look at us and say, oh, well, you're this age. Oh, well, you're close to that age. Oh, well, this is my life now? We're just supposed to live in this state of, I don't feel good, I've got all of these symptoms, but you can have birth control pills. Why don't you actually figure out what is going on? Why do we have to sit here and suffer and accept that that is just what we do now? This is the second gynecologist that I have seen in 6 months, and their only solutions are IUD or birth control pills. I've also talked to an endocrinologist. I have also talked to my PCP. I guess we just suffer, and or we go to TikTok and we talk about what's going on with us because for some reason talking to strangers on the internet gives you a better result than paying all of this money to speak to people with medical degrees. And then they act like we're crazy when we're like, oh, well, I saw on TikTok. Oh, well, I Googled. And they act like we're crazy. No, we just would really like some help. We would really like to not feel like crap. We would really like the money that we're spending on insurance premiums to actually do something for us. For the love of all things holy, please, please get it together. Please, America, you are doing women such a disservice.
Yeah, guys, I hope this lady gonna be okay and she find a solution and everything's gonna be alright. If you have any advices for this lady, let me know in the comments below. Let's dive in the next video and watch.
UCare has withdrawn from Medicaid, impacting 11 Minnesota counties and around 88,000 Minnesotans. This will impact those that are on prepaid medical assistant program as well as Minnesota Care. However, seniors or people with disabilities will not be impacted. The 11 counties that they are withdrawing from Medicaid from are Benton, Chisago, Crow Wing, Pennington, Ramsey, Roseau, Sherburne, Stearns, St. Louis, Wallina, and Wright County. They said they are withdrawing from these 11 counties because there are 2 other health options available through Medica or Blue Plus, and they will start helping people transition to these plans. UCare said in a statement that they are not getting the reimbursement that they need from the government to cover the rising costs of healthcare, and being enrolled in Medicaid at this point is not sustainable. As we know, rural areas get hit the hardest when healthcare costs rise because most people in rural areas are on Medicaid. Medicaid is what keeps hospital doors open. However, if health insurance companies are losing money drastically, they will unenroll from Medicaid, leaving people without health insurance and ensuring that hospitals in rural areas will shut down because they simply cannot afford to stay open. Now, this will probably be an even bigger trend come 2026 when those Medicaid cuts come into play from the big, beautiful bill. Minnesota is set to lose $500 million in federal funding for Medicaid, which is going to have a huge impact on healthcare here in Minnesota.
That's what happening, guys. Let me know in the comments below what happened in your areas. I'm trying to add stories from different part of the country, so you can understand what is going on. Okay, guys, let's dive in the next video and watch.
I want you guys to know that in 2025, as a surgeon, as a doctor, that in order for me to care for my patients, I have to care about insurance. So I do breast reconstruction. That means I care for patients affected by breast cancer. The diagnosis of cancer is really financially devastating, right? And so although, I love to operate and it would be great if I could just channel my energies into that one thing all the time, that's not the reality of navigating healthcare with my patients. Now, if I don't care about insurance, if I don't think about insurance, then, it's possible that my patients could get stuck with a huge bill for surgery if I don't do all the right things ahead of time to get approvals. The other thing is that in order to practice medicine in the US, I had to decide whether I was going to take insurance, be in network with insurance or be out of network. And increasingly, it's become more and more expensive for patients, like my patients with breast cancer, to get care when they're out of network. So your out of network payments have gone up and up and up over the last many years. So I've always thought that it was the best thing for patients for me to try to be an in-network provider. And I've worked really hard to do that. That way I've tried to participate with as many insurances as possible. I take Medicare and Medicaid and TRICARE and United and Blue Cross and Aetna and Humana and all the things, just because I want when my patients come to see me for them to know that that insurance won't be a hindrance for them. But unfortunately, it still is. So we'll talk more about that. But I just wanted you guys to have the perspective for me of why is it that I care so much about insurance? It's because I care about my patients. And the reality for them is that if we don't navigate that system really carefully, they can get stuck with huge bills.
Yeah, very, very interesting thoughts. And, you see she's cared about her patients, and that's why she's cared about their insurances. So trying to cut their bills. It's very good. Okay, let me know in the comments below, guys. I'm done for today. I hope you enjoyed this new episode. Like always, guys, be safe and bye for now.